Expensive drugs. Another way. Spread costs. I had an interesting experience with my own Medicare prescription drug plan, and I think many seniors need to hear this. I went to pick up my prescription, and the pharmacy told me the cost was almost $700. Now, I have been in Medicare for a long time. I understand deductibles, tiers, co-pays, formularies, and all the little surprises that can come with prescription drug plans. But I have to tell you the truth. Even I was surprised. I paid the bill. Then, on the way home, I started thinking, wait a minute. Medicare has something called the Medicare Prescription Payment Plan. This is a program that allows people with Medicare Part D prescription coverage to spread their out-of-pocket drug costs across monthly payments instead of getting hit with one large bill at the pharmacy counter. So I enrolled online. Then I went back to the pharmacy and asked if they could reprocess the prescription under the payment plan. At first, they said it might take 24 hours to show up in their system. So I came back the next day, and they did it. They refunded the amount I had paid and reprocessed the prescription through the payment plan. Now here is the important part. The Medicare Prescription Payment Plan does not reduce the maximum $2,100 prescription drug cap for 2026. It only changes how you pay it. That is the point many people may miss. In 2026, the Medicare Part D prescription drug cap is $2,100 for covered Part D drugs. That cap helps protect people, but the payment plan is different. The payment plan does not lower the cap. It does not make the drug cheaper. It spreads the cost over time so you are not hit with a large bill all at once. And that can make a big difference when you walk into the pharmacy and they tell you your medication is $500, $700, or even more. So the lesson is simple. Before you pay that prescription bill, look for another option. That option may be the Medicare Prescription Payment Plan. It may be Medicare Extra Help. If you live in New York, it may be EPIC, the Elderly Pharmaceutical Insurance Coverage Program. Many people do not realize New York has prescription help for seniors with income as high as $75,000 for a single person or $100,000 for a married couple. That is not just help for the very poor. That can help middle-class seniors too. If you live in Florida, North Carolina, or another state, your options may be different. But that does not mean there are no options. You can check with your state Medicare counseling program, your pharmacy, your drug plan, Medicare.gov, and manufacturer assistance programs. You can also look at discount pharmacies and prescription savings tools. Now, one warning, many manufacturer coupons cannot be used with Medicare Part D because Medicare is a government program, but that does not mean you should ignore manufacturer websites. Sometimes they offer patient assistance, information, savings resources, or guidance on where to look. The real message is this. Do not assume the first price you hear at the pharmacy counter is your only path forward. Ask questions. Can this be reprocessed? Am I enrolled in the Medicare Prescription Payment Plan? Does my state have a prescription assistance program? Do I qualify for extra help? Is there another pharmacy with a better price? Is there another drug on the formulary that my doctor could consider? Is there a different Medicare plan I should look at during the proper enrollment period? And one more thing. The $2,100 prescription drug cap is one of the reasons we are seeing so many changes in Medicare drug plans and Medicare Advantage plans. The cap gives seniors important protection, but it also changes the financial pressure inside the system. That is why people need to review their plan every year. The plan that worked for you last year may not be the best plan for you next year. So here is the takeaway. High cost does not mean no choice. Before you pay that prescription bill, look for another option. If this information helped you, please subscribe to our channel. It helps us keep spreading honest, useful Medicare and health information for people on elderhood.info and medicareselfenrolled.com. Please also like this video, leave a comment, and share it with family and friends who may need to hear it. Sometimes one shared video reaches the exact person who needed the information that day. Thank you for watching. Stay informed, stay strong, and keep taking good care of yourself. Our code of conduct follows next.